My name is Henry Daniel Zegzula. Most people call me Dan. I'm a plastic surgeon in Portland, Oregon. I think patients' goals are where we start. What are you trying to achieve from this operation? What are your goals and how can I help you get there? I think those are important things to ask and important answers to get before making a plan. Many times after nursing, there's going to be some ptosis involved. So lifting and breast reduction, that's also kind of a spectrum, right? If you're lifting a breast but not making the volume smaller, then we're talking about a breast lift. But if we're lifting the breast and bringing the volume down a couple of cup sizes, then that's a breast reduction. Many times, patients are surprised when I tell them, I think maybe insurance will pay for your breast reduction. And a mommy makeover that's partly done under insurance is always a special treat for them because they weren't expecting that insurance would pay for any of it. But if they meet certain criteria, then the breast reduction part of it might be covered under insurance. Perhaps the most common disagreement would be patients who are asking for breast implants that are larger than their frame would support. So I have to educate them about the risks of that and how their bodies, their tissues might not support a large implant over long periods of time. There is a range in which I'm comfortable with. I try and talk them through the process and my thinking about the operation and what I think is safe. On rare occasion, I would just have to tell them, I can't be your surgeon. If this is what your goal is, I can't achieve that safely. But that's a rare thing. Yeah, I think geographically, there are differences in what patients' goals are. I think one easy one is breast implant. The average breast implants that are being put in are larger the farther south you go. So in Southern California through Arizona, Texas, and all the way to Florida, they're putting in, on average, larger implants. In the more northern states, smaller implants, more of a sporty and athletic look than a busty, curvy look. But within certain geographic areas, you're going to have people that want everything. But I think on average, we're more conservative in the northern parts of the United States with implant size and bust size. I have had the privilege of doing breast augmentation on several of my running friends, and they are all still faster than me. I think the short answer is no, and I've asked that question. Do you think that your breast implants have changed your speed, your endurance, how you feel when you're running? And they've said no. Yeah, they said it hasn't made a difference. But they like the way they look in their running bras better. They're very, the runner, very lean body, usually small breast volumes, and many of them are mommies. And so after breast augmentation, they're super happy with the way they look, and it hasn't affected their speed at all. As a matter of fact, some of them did their personal best marathon times after their breast augmentations. I'm not going to take credit for that, but there you have it. It hasn't affected them much.